Well, we would start at 7 o'clock in the morning, and then there were more or less a team of 10 orthopedic surgeons and podiatric surgeons. However, the Operation Enduring Freedom and Iraqi Freedom, which are Afghanistan and Iraq troops, there was only one soldier doctor assigned to that aside from the civilian doctor that was with them. So we were really extenders of what they were capable of doing. We doubled what they had, the government had assigned to it. And I think they probably, depending on how much trauma there is in Iraq and Afghanistan, that would determine how many doctors from over there are assigned. But when I was there was one. So, you know, on a weekend, one doctor for all the patients evacuated from Iraq and Afghanistan, and then in addition me. So we were busy, and you did whatever came in. So from the one weekend was the Columbus Day weekend. So Friday was a holiday there, Monday was a holiday there, so there were two of us for the entire Iraq, Afghanistan evacuees, and that was a busy weekend. The worst injuries were from the IEDs, the improvised explosive devices, and the soldier would be in their Humvee or in the field and hit by these things, and the insurgents have become very creative in what they're making these devices with. They're loading them with things that, when they explode, shoot a lot of shrapnel out, so the worst injuries, aside from death, which fortunately we didn't see when I was there, I think that nobody died that was transported to Landstuhl that I saw. However, there were at least 3 soldiers that had 3 limbs amputated. One fellow with both his lower limbs at the pelvis was amputated. One fellow who had his entire hemipelvis and leg amputated. So that by far, in a way, was the worst orthopedic injuries I saw. Other injuries that we saw related to orthopedics were the patients with significant burns. So one fellow had 80% burns on his body that survived and made it at least back to the United States after he was stabilized in Landstuhl. It's a beautiful, clean facility, but the issues, as I found, is that the doctors really, I felt, were over there alone, without the support of here at New York Hospital. I can get any equipment anytime I want it within 24 hours. The hospital has a system where they have contracted with vendors. We have great relationships based on being at New-York-Presbyterian with the vendors, and basically the latest, greatest I can get within 24 hours to fix a patient in the way I think is best. Over there's nothing like that, and there was nothing like that. So yes, I have the full armamentarium in the United States. I suggested it on one soldier, and then had to go find it and pick through the implants that they had and improvise, and that was the difficulty in dealing with it. And subsequently I started it while I was over there. The primary vendor that we use in the United States and here at New York-Presbyterian Hospital had no relationship with that hospital. They basically dumped the equipment off and left them with the very basics, very standard equipment. And over there I started a process that got them more involved. And they actually, I found out within the last month, that company put a full-time representative in that hospital to see the needs of the hospital, bring equipment, donate equipment to the American troops and the soldier doctors, so that they wouldn't have the limitations that I found when I was over there in October. You just can't forget some of the things you see. You know, I grew up with MASH on television and was a little too young for the Vietnam War, but knew my neighbors across the street who had, you know, gone and served in the Vietnam War. One fella didn't come back, and you know, this was, you know, you see it but you can't believe it on television, and this is it really hits home as to the sacrifices that people make, and you learn what freedom isn't free means. That we sit here and can criticize the process, we can criticize the politics of the war, but there's absolutely no way that you can criticize the soldiers that are over there. You know, they are there. They truly believe what they are doing is right. I can't blame them. No matter what I feel about the politics or why the reasons for going into the war, but they're over there, and they deserve our support in any way we can give it to them. And in particular, you know, them coming back with these devastating physical and mental injuries, that there is no level of support that we as a community and a society shouldn't give them because of what they're doing and what they believe they're doing for us.